Welcome back to the Deep Dive. Today we are tearing into a really fascinating topic, a kind of quiet revolution that's happening right now across the entire planet.
Right.
Global population aging.
It really is. And it's something that goes way beyond just, pensions or healthcare costs.
Absolutely. It's a fundamental restructuring of society.
Okay.
And I want to start with the fact that, for me, just completely reset how I think about this. As of 2020,
Right.
the number of people on Earth age 60 and older outnumbered children younger than 5.
For the first time in human history, it's a profound shift.
It is. So for our deep dive today, we're really focusing on health and our readiness for this. We need to unpack what this massive rapid change means, not just for our bodies, but for our communities, our economies, our infrastructure.
Mm-hmm.
Our mission is to figure out why this is such a challenge for health systems globally.
Yeah.
And, what are the factors that really influence what the experts call healthy aging?
Mm-hmm.
Okay, let's unpack this. And I think we have to start with the sheer scale and speed of it all.
Megatrend is really the only word for it. And you're right, this isn't a regional thing. Every single country is seeing growth in the size and, crucially, the proportion of older people.
But it's the speed that's different this time.
Right. Exactly. The pace of population aging right now is it's so much faster than anything we've ever seen in the past.
And that speed is what makes the numbers so jarring.
Mm.
Between just 2015 and 2050, the proportion of the world's population over 60 is set to nearly double
It's a jump from 12% to 22%.
in just 35 years.
Think about the actual number of people. In 2020, we were at about 1 billion people aged 60 and over. By 2030, that's already jumping to 1.4 billion.
Which is just around the corner.
Just around the corner. And by 2050, that population is expected to double again to 2.1 billion people. It's like adding the entire current population of China and India combined just to the 60-plus group.
Wow. And the real pressure point, from what I've read, is within the oldest group, the people aged 80 and over.
That's the cohort that often needs the most intensive support, yes.
And that number is expected to triple between 2020 and 2050. We're talking 426 million people. That demands a kind of readiness and infrastructure that, for the most part, we haven't even built yet.
And that concentrated growth is exactly why this can't be a niche issue anymore. It has to be central to how we think about sustainable development.
So we know the numbers are massive.
Yeah.
But where is this happening? I think most of us, when we hear aging population, we immediately think of, Europe or Japan.
Yeah.
Right? Japan's a classic example. 30% of their population is already over 60. And that is where this trend started, in high-income countries.
It is. But if we connect this to the bigger picture, the really critical story today is that the center of gravity has shifted completely
To where?
to low and middle income countries,
Oh.
LNMICs. They're now experiencing the greatest and fastest change. That right there is the global policy challenge of our time.
So why is it happening so much faster there?
Well, it's a mix of things. It's falling fertility rates, better childhood survival, better control of infectious diseases, all happening in a much, much more compressed time frame than it did in, say, Europe.
And the projections show that concentration is just going to become more dramatic.
Oh, absolutely. By 2050, 2/3 of the world's population over 60, some models say up to 80%, will be living in these low and middle income countries.
80%?
80.
So the vast majority of older people will be living in regions where health systems and social safety nets are already, to put it mildly, under a lot of strain.
Exactly. It places this potentially catastrophic pressure on systems that maybe don't have the robust pension funds or the specialized geriatric care that took decades to build elsewhere. This completely changes the global readiness equation.
So we need to get past the census data then and really get into the biology of aging, because that seems to be where the solutions for healthy aging might actually start. We know, okay, biologically, aging is this accumulation of damage at the molecular and cellular level, a slow decline. But the sources pointed to something I found genuinely surprising. And here's where it gets really interesting.
Right.
These biological changes, they're not linear. They're not consistent. They're only loosely tied to your actual age in years.
Which means there's this enormous diversity in what older looks like.
Enormous. And the sources say this diversity is not random. They specifically point out that some 80-year-olds have the physical and mental capacities of a 30-year-old. That just shatters our assumptions.
It absolutely does. And that diversity is the key to everything because it tells us that decline isn't a fixed destiny. But we can't ignore the clinical reality. As we age, we do become more vulnerable to certain chronic conditions.
And the list is pretty familiar, I think.
It is. We're talking about hearing loss, cataracts, back and neck pain, osteoarthritis, COPD, diabetes, depression, dementia. The real challenge is that older people often have several of these at the same time.
And then there's this other category, right? The geriatric syndromes. That sounds very technical.
It does, but it describes very real, everyday struggles. Think of them as complex health states that aren't caused by just one thing. They're the result of many underlying factors interacting.
Like what?
Well, the main ones are frailty. That's a general decline in strength. Urinary incontinence, falls, delirium, and pressure ulcers.
Let's just take falls for a second.
Right.
Because if a young person falls, you look for a cause,
Yeah.
right? A wet floor, they tripped. It's simple.
Exactly. But a fall for an older person is rarely that simple. It might be poor eyesight, plus a side effect from a medication, plus bad lighting on the stairs, plus a loss of muscle mass. The whole system has to be considered, not just the broken bone that results.
Which brings us to what feels like the central tension in all of this. The huge difference between our lifespan and our health span.
That's it. That's the core problem.
We're all celebrating living longer. And of course, a longer life is an amazing opportunity for more education, a new career, more time with family. But all of that depends on one thing.
On your health. And the evidence is pretty stark. It suggests that the proportion of our life that we spend in good health, our health span, has stayed pretty much the same for decades.
Meaning the extra years we've gained.
Are often years spent in poor health, dominated by declines in physical and mental capacity. We're adding years to life, but not necessarily life to years.
So if it's not a fixed decline and some 80-year-olds are thriving, why are so many people spending these extra years struggling? Is it just a genetic lottery?
No. And that's maybe the most hopeful message in all of this. The sources are very clear. Most of the variation in health in older age comes down to our physical and social environments.
Our homes, our neighborhoods, our communities.
Yes, along with personal characteristics like socioeconomic status.
Wait a second, that feels like a massive paradigm shift. If the biggest driver is the environment, then you're saying that things like urban planning, transportation policies, social equity, these are primary health interventions.
They are just as crucial as medicine. That's exactly the point. The environment is what determines whether those biological changes lead to resilience or to frailty. The most incredible detail is that even your environment in utero or in childhood can affect your health outcomes 70 years later.
That reframes the entire challenge. It's not just a medical problem anymore.
It's a political and a policy imperative.
Okay, so if the environment is the biggest lever we can pull, we have to talk about what designing for healthy aging actually looks like.
Right.
On the individual level, the behaviors are what you'd expect. A balanced diet, regular physical activity, not smoking. These things reduce disease risk and delay dependency.
But again, an individual's choice to go for a walk is hugely influenced by their environment. It can be a barrier or an incentive. A supportive environment is one that helps people keep doing what's important to them, even if they've lost some capacity.
Right. You can tell someone to walk more, but if the sidewalks are broken and there are no benches to rest, that advice is useless.
Exactly. So supportive environments means safe, accessible public buildings. It means accessible public transport, places that are just easy to walk around in.
And these are policy choices. Accessible transport doesn't just help an older person, it helps a parent with a stroller, a person in a wheelchair.
It helps everyone. Investing in age-friendly design maximizes capacity for the entire community, which is why the public health response has to be about reinforcing ability and adaptation, not just managing loss.
But there's a huge social barrier to all of this. one that can undermine every policy
The
effort.
ageism.
Yes, that subtle and sometimes not so subtle prejudice that just assumes all older people are frail or dependent or a burden on society.
And that assumption is so damaging. It leads to discrimination at work, it limits opportunities, and it shapes policy to be about crisis management instead of prevention. We're sidelining a huge, diverse group of people based on a number,
And this is all happening while the world is also dealing with globalization, urbanization, new technologies.
all of which have to be factored in. This complexity is what led to the UN declaring 2021 to 2030 as the decade of healthy aging. It's a global action plan led by the WHO.
And it had four main pillars, four areas for action.
It does. First, and this is the foundation, changing how we think, feel, and act towards age and ageism, just tackling the prejudice head on.
So,
Second, developing communities that foster the abilities of older people. That's your safe neighborhoods and good transport. Third, delivering person-centered integrated care that's actually responsive to their complex needs.
and the fourth, which seems crucial given that tripling of the 80-plus group.
The fourth is providing access to quality long-term care for those who need it. Because without that, the strain just falls back on families and hospitals that are already overwhelmed. And this raises an important question, especially for those low and middle income countries we talked about. How do you find the resources to implement all four of these areas when you're also facing urgent needs for basic economic development or fighting infectious diseases? The challenge isn't knowing what to do, it's how to do it all at once.
So what does this all mean? The core insight for me is about scale and urgency. Population aging is huge, it's fast, and it's concentrated now in the developing world. And the quality of those extra years we're all getting, our health span, it depends way more on our environments and our policies than it does on our genes.
The environment is the mechanism. It's what turns biology into either resilience or frailty.
So if we accept what the data tells us, that it's biologically possible for an 80-year-old to have the capacity of a 30-year-old, then the question becomes, what fundamental environmental and social changes are required to make that the norm instead of the rare exception, especially in the parts of the world aging